Hello and welcome to the Medical Sales Podcast, and I am your host, Samuel. In this podcast, I interview top medical sales reps and leading medical sales executives across the entire country. And it doesn't matter what medical sales industry, from medical device to pharmaceutical to genetic testing to diagnostic lab, you name it. You will learn how to either break into the industry, be a top 5% performer within your role in sales, or climb the corporate ladder. Welcome to the Medical Sales Podcast. Hello and welcome to the Medical Sales Podcast. So I'm not going to spend too much time talking about what we have today because if you were here last week, which you should have been, you would have heard from three great providers, pain interventionalists, talking about all sorts of things, from the way they run their practices, deal with manufacturers, and how COVID is impacting everything. So today's episode is the continuation of that discussion, part 2. So again, thank you for listening to the Medical Sales Podcast, and I really hope you enjoy the interview.
One thing that you guys talked about a little earlier was how, you guys are pain interventionalists. You guys focus on pain. That is the field, and it's shifted now to COVID. But Dr. Baber, you just said the issues around pain are still very much there. It's not like that's died down while COVID has increased. So has it just become relatively hectic to manage, and everyone is just trying to spur of the moment, figure things out along with manufacturers? Or has there been some kind of process you guys have been able to implement that's allowed you to still address what's going on with pain in light of what's going on with COVID?
Yeah, so this is a difficult question that we all have had to address during the height of COVID, right? So what's more dangerous? Having a patient come into a procedure room and get a procedure, or having that patient's pain not be addressed and then having them go to the emergency room because they're in such bad pain, where they could be in a room full of other people with COVID, right? So it can be a catch-22, and we have to kind of look at each patient individually and ask ourselves, what is the best thing for the patient, right? Or what is the least dangerous thing for the patient, right? Because if a patient, if you tell a patient you can't get a procedure, and the patient tells you back, well, my pain is so bad, I have to go to the emergency room, right? Nobody is doing anybody any favors, right? We're not decreasing the risk for that patient at all, right? So we have to take multiple things into account when we look at each individual patient. And I'll be honest with you, in the beginning, it was a scramble, right? Because it was like on day X, everything was normal, and on day Y, there was a shutdown, and there were hundreds of patients, sometimes thousands of patients in a queue for procedures, and then we had to communicate with each and every one of our patients to figure out how we're going to optimize their pain when they couldn't get their procedures. And as a physician, I relied on not only my personal communication with the patient, I relied on my reps, and I relied on my nursing staff and my medical assistants and my secretaries to kind of all come together and figure out a way to, optimize the patient's care and communicate with the patient effectively.
This is a really great question, Sam, and part of it goes back to my earlier point. How do you get people to essentially follow a set of rules if they have such differing opinions about what COVID really is? So this is the challenge, right? So meaning that should every practice incorporate testing as part of their care delivery versus does it make sense for some practices to do that? Like if your practice is really in a rural town where the concepts of certain things of including 5-minute rapid tests versus sending serology and X, Y, and Z in a large health system where we screen everybody that comes in. Yeah, this is great because I work at a big health system that's being as rigorous as possible in terms of doing testing, essentially screening patients appropriately. So one part is once you accept, to me, a part of this, the challenge is I think someone was alluding to this, the value of science. Like right now, we can't get consensus among people about what is reality versus
Right.
not.
Right.
So if there isn't real consensus around that, then how do you tell practitioners of all different areas to actually adopt a certain way of care delivery? I can tell you, we rigorously use testing. We screen and test everybody that gets a procedure before. You need a COVID test 72 hours before the actual procedure. I can say that because I have a big health system backing my practice,
Sure.
right? And it's nice that you got everybody practicing in different environment. That may not be realistic for everybody, but if there is a certain acceptance of facts, then one can start to say, how do we divert those resources to make it possible for everyone to do that? So I think Zafeer's point is really, really completely accurate. I mean, it makes it challenging because it's just that I think I go back to, we need more folks educating the broad masses on what's factual. Then people can actually try to take some of the guidelines and policy. We even done this at the society level where we put out a bunch of different guidelines. And I think you talk about, I think Zafeer, I know you wrote a paper with Steve, if I'm not mistaken, and the point is people should be reading that. You try to implement some of that. I think a lot of great folks have tried to come up with some solutions across society levels to educate the pain docs on how to care deliver. But the starting point is accepting the base set of facts. Okay, this is something we need to address. And then you kind of adapt that after the fact on what's relevant.
What paper was this, Dr. Baber?
Yeah, so I basically, right after COVID hit, we, as pain physicians, we started asking ourselves, how do we deal with this, right? How do we deal? When do we know when to do a procedure? When do we know not to do a procedure? When do we know, how do we treat our patients? And, as physicians, we frequently ask ourselves, what is the standard of care, right? And what is the consensus amongst our colleagues? And frequently the standard of care and consensus is built on basically what different societies, like different societies, like pain societies, for example, adopt as what normal policy is. And a lot of times these pain societies get information, develop a consensus based on what different leaders in the field have to say, right? So these societies get different leaders in the field, they work together, they develop a consensus, and then that consensus is frequently considered the standard of care. And so once COVID hit, there obviously was no consensus because this is new to all of us. So basically, me and some other physicians, we got together and we developed a paper. We wrote a paper to to basically say, how we should deal with COVID. And so, it involved me, it involved some of my colleagues at Hopkins, another colleague who I think is at Stanford now, and some of my military colleagues as well. And we kind of just got together and worked really hard, really quickly to kind of just develop this consensus paper to give guidelines to pain physicians across the country to how to deal with COVID-19. And I think Krishnan just sent you the link.
Yeah. So I sent, Zafeer's paper, we've done some other stuff through Aspen, American Society of Pain and Neuroscience, where we put out some guidelines. And we just got this recent manuscript looking at strategic testing. But I want to say something, Sam, that's important. For even, let's say, testing is at one end of it. Sure. Simple things like wearing a mask for all of the employees in your practice. I mean, talk about simple social distancing measures. Should you have a basic screening tool for any patient walking in? Have you had a cough? What are the symptoms of COVID? I mean, these are very practical things you can apply, right? And so that's what I get back to is these are things that you can apply in a very rigorous, systematic way. I get maybe not every center can test, and that might be a challenge for based on the resources, but I think it comes back to, again, pushing good factual content out there of the benefits of some of these things.
Sure.
And I'm not sure a lot of people still feel strongly about that. And it's kind of where we are today in this climate of, you talk about the impact of social media. That is a big part of it. How do you screen what's factual versus not? So,
right. So I had another question. It deals with what we're talking about right now, but I want to get your guys' insight on it. So how many of you work a lot in surgery centers?
I do.
You do work a lot. How about you, Dr. Baber, Dr. Krishnan? Surgery centers?
So I am in a hospital-based program. So it's not necessarily like a strictly outpatient surgery center like Dr. Cohen has.
Sure. So I wanted to ask you then, Dr. Cohen, how has working in surgery centers, has it been, what's been easier or more difficult to manage with everything you're trying to do regarding COVID and addressing your patients and dealing with manufacturers? Does the surgery center environment make that a simpler thing to do, or is it the same kind of issues? And just tell us a little bit about that.
I don't think it's made it a simpler thing to do, but I think it's made it a safer thing to do, which I think is necessary. Once, we're, adding, different doors to walk in, not, in Southern California, we're lucky with our great weather, as some of you guys know. Sorry, Zafeer. We can eat, we can eat lunch outside in December, 6 feet apart, and even, in November and socially distance, that way. So the surgery centers that I work at and I'm affiliated with, they've really put in rigorous testing for staff safety, patient safety, rep safety. And, with those steps, has been more inconvenience, because I think anytime you have more steps, it's more inconvenience. But I think the safety for the patient significantly outweighs any inconvenience, to prevent, the spread of this, virus. So I think it's been a good thing. And, I think it's sort of worth, waiting a few extra days to make sure there's a COVID test and, all the necessary steps that are put in.
Yeah, I actually, this is a great question, because I think Zafeer alluded to this at some earlier, but I think a lot of industry feels, when you talk about the delivery of spinal cord stimulation, people are doing a ton of trials, and now there's a huge buildup of patients that are trying to get into ASCs for their pain clinicians to actually do the permanent implant. And I think a lot of industries like, well, how do we solve this issue? Everybody's doing a ton of trials in their office, but we can't get them into these ASCs to essentially do the latter part of the care delivery. So I think, again, it goes back to hopefully that backlog gets resolved in some ways, but there needs to be a good, consistent, either you incorporate testing or certain suggested social distancing, et cetera. But I mean, it may get resolved, but I think that's something that industry needs to adapt to. I go back to this. I don't see this suddenly getting resolved in the next month or two. I think come January, February, this is going to be an ongoing issue. We don't know where the impact of vaccination is going to play into it, but we're ways away from that. It's a great question, a challenging one. I think everyone's trying to answer this. It's like, how do we get these patients into the ASCs to actually get the perms done post-trial?
I think as much as procedures, a lot of what we do is elective, there are significant comorbidities with patients. I mean, I think, our patient population has such a high concurrent rate of depression. And then, now it's compounded with social isolation. I've looked at studies in chronic pain patients with depression. They're at higher risk for suicide. They're at higher risk for alcohol abuse. So when we do talk about, these procedures being, elective, they are elective, but they can also be life-changing to people and really put people on a path to opioid reduction, life improvement. I'm sure we've all shared patients or, patient experiences where, patients say we gave them, sort of, a new outlook on life or sort of a second chance to, live a life off these medications and be more functional and really enjoy life again. So, we do sit here and say elective, elective, elective. But I think from the patient's perspective, sometimes it's really not that elective,
Yeah, that's a really good point.
And that's, why we rely on our reps so much, because, the reps are in constant communication with our patients. And when it's time to switch to the implantation, we kind of know through our reps, which patients, are more urgent than the other patients. And the reps that I talk to, they love their job, right? They really go into the profession because they want to change lives. They enjoy working with physicians, and they like being in the operating room. And, the reps, when I talk to them, they say, I love my job because I first meet a patient, and, a lot of times they think their life is over. They have no function in life. Their life is overcome by pain. And the rep plays a pivotal role. The process of, the patient getting, a spinal cord stimulator, for example, and by the end of their experience, the patient's life is altered. And, the reps that I talk to, they just really love that aspect of the job. And COVID-19 really, made it more difficult for that process to be completed. And that means that the process is a lot longer than it used to be, right? So this process that used to take, weeks or a month, is now taking several months and could possibly take several years, which means that, instead of relying on a rep for a short period of time, we're relying on them for this much longer period of time. But I suspect that, when the implant gets done, it gives the rep, that much more satisfaction in their experience, because, the rep plays such a pivotal role in altering the landscape of the lives of these patients.
So then moving forward, as everyone continues to navigate this environment that we're in, what would you guys say you would love to see from the manufacturing side of things? What would you love to see? And some of it might already be happening. Some of it you've thought of it, you've had a passing thoughts of, it'd be so nice if this could happen. All of you, what would you like to see moving forward with manufacturers?
Well, I guess I can go first. So spinal cord stimulation is an ever evolving field, right? Like, even the spinal cord stimulators that were state of the art when, we were training, which wasn't that long ago. All of us are relatively young. It's changed a lot since then, right? And it's a field that continues to evolve. It continues to change. And I don't know. I mean, for example, when these spinal cord stimulators are implanted, there are different settings that you can change within the actual spinal cord stimulator itself to kind of optimize the patient's pain. And sometimes for that to happen, the patient needs to actually come into a physical space with the spinal cord stimulator rep, so the rep can adjust the settings. I don't know if there's a future where the rep can do that remotely, because we're going to have to be more reliant on remote medicine. If that's a possibility, that would be great. But who knows what the future brings?
I think that we're in a very competitive world. Every manufacturer and company wants to have a larger market share. They want to be the company as a go-to for things. But one of the opportunities that this presents is for these companies to come together and actually try to address an important issue. And I think that at the end, the care model is pretty consistent, whether you're using Boston Scientific, whether you're using Abbott, whether you're using Medtronic, whether you're using any of the other potential vendors that are out there, the actual impact of how that care is delivered and the relationship with all of the different pieces is pretty consistent. So, one of the things I would love to see all these companies come together and say, hey, this is our approach for where we are today in the COVID climate about protecting the patient, protecting the physician, protecting their employees. And that may just require some amount of coordination among all the different groups that can happen at a society level. But I think this is a great opportunity for manufacturers in this space to come together. I mean, I don't see that happening very often, but set aside what the individual differences is and really say, okay, this is what's looking like in the winter. This is what's going to be happening in January. How do we sort that out? How do we really get across the board some consistency, right? And I think it's better for all of our patients too. I think if they can work together on that.
Yeah.
Look at that. How could you not feel that way with that little cutie on the podcast?
I get a few moments with my kid in the morning before I go to work, so I definitely got to hold him right now on the podcast. He's the joy of my life.
Oh, wow.
I echo what Dr. Krishnan said. I think the one thing, Sam, to your question, what's the one thing that, pharma and industry can do? I think it's sort of a thing that we all can do as just people right now. It's just have understanding, respect other people, know that other people have different views, put the patient safety, number one. And that's, we're all coming from a place of greater good, for the patient. And I just think that, everyone, we all view this differently. But the patient's safety as our own now, because this is sort of a weird situation where now we're talking about physician, staff, and rep safety as well. All that stuff just needs to sort of be, more of a team working environment. And I think a lot of that is just, understanding that people have different views and you don't have to agree with them, but you got to respect them. And it's really, again, just out of someone's, want for safety and in the care of, health, and I just think that's really the biggest thing that needs to be done.
Yeah. When I hear that, I wonder, especially when it comes to manufacturers, like you were saying, standard procedures, what is the rule of thumb that's shared by everyone across the board? That could be just a good step towards everyone at least working for the greater good together, as opposed to competitively and individually.
Yeah, I mean, look, go ahead, Zach.
Well, I personally don't think there is, one step, because this isn't like, a one size fits all solution. I mean, here you have 3 doctors on here that all have very different practices. I mean, I don't know if the university setting can extend their hours. That's something that we've done in private practice to reduce our patient, flow, to keep people safer, to have, less people in the waiting room. Everyone has different resources, but I think, with having that sort of general respect that every situation is a little different, with the greater good of the patient and staff and everyone's safety, is the most important. I think that just really takes precedent.
And it brings up a good point, though. I think all the manufacturers understand that their demographic of customers can range from faculty at the university to a small private practice. So again, it goes back to education today is a lot easier. To Zafeer's point, he can get on a webinar and hear some guy across the world talking about a topic. But how you're dispensing that education, the content of that, is hugely critical. So if you can get some consensus across the board among the different manufacturers that this is what we think should be done for ASCs, this is what we think should be done at university settings, I think that would be really helpful. I mean, I think it would help in getting, at the end of the day, everybody wants best for our patients. So that's 2 fronts. What do you deliver, and how do you deliver, and how do you get them access to that? So yeah, I think it's a great initiative. It should have probably been done way sooner, but I think there's got to be some consensus and unification around that. And that's something everybody can work towards as a common goal.
Definitely.
I think we all went in this because we love seeing people get better and helping them out, and this is just sort of an extension of that, you know?
Right.
Absolutely.
Yeah, I mean, I think it's really important for these companies to get together. I think, frequently the company overemphasizes their technology and underemphasizes their rep. And as Dr. Cohen said earlier, I think when it comes to a specific spinal cord stimulator, the race car driver is more important than the actual race car, right? I would, and I've talked about this earlier with you, Samuel. Like I would much rather pick a company with a good rep than a good the good spinal cord stimulator, because ultimately I think the better rep will make a bigger difference to the patient than the quote unquote better technology. So I in the future I would actually like to see more emphasis on the actual rep than this subtle change in technology, because ultimately that's what is going to make the difference in the patient's life. And all things being equal, I would definitely pick the rep over the technology.
I'm just going to add one thing, Samuel. Like, I think right now we talk about subtle differences, and I think the science has come a long way. There are more and more level 1 evidence studies that are supporting specific indications, MRI compatibility, all of these things that we think about in our patients. But I can imagine that in about 5 to 10 years, the way we think about these devices is going to be totally different. And the advent of miniaturization is going to drive that conversation in a totally different model. And maybe, who knows, whether we're going to be ever doing implants in an operating room, right?
Well, yeah. I mean, we look at things so differently today than we did 5 years ago. So,
Right.
I mean, for the evolution of the field, I hope that we look at things very differently in 5 years. And I mean, I'm excited for all that stuff personally.
But I think Zafeer's point is a good one, in the sense that, especially regarding safety and care delivery, the reps are a critical part of the folks that are out in the field. And
Completely.
I think and that's where essentially what you dictate in terms of all the expectations of them interfacing with a practice, testing, what are the things that everybody would be wearing masks, all these things. There's no time like the present to have that addressed. I think I really feel strongly about that.
Yeah, no, I agree.
This was excellent, gentlemen. I really appreciate all the time that you guys gave and all the knowledge and wisdom that we were able to share and discuss. Lastly, any of you, and I'll start with Dr. Baber. Anything you want to share with the audience before we wrap up today?
Whether you are a rep new in the field or whether you've been there for years, find one good mentor, like one person that can show you the ropes, and form a good relationship with them. I mean, I'm just looking at the podcast right now, and I was thinking to myself, my God, like if 10 years ago you would have told me that I'd be doing a podcast with Zach Cohen, and he'd be holding his baby and talking to and looking and talking to me, I'd be like, that's crazy. Because I'll be honest, 10 years ago, this is not how I saw Zach Cohen. Like, we were friends skiing. We were friends skiing in the Rocky Mountains, and and we were not even thinking, like, we weren't even thinking about this. And oh my God, he's holding a baby, his baby right now. And,
not only any baby, my baby.
Yeah, his baby. And it shows to me how important relationships are, because look at how our, me and Dr. Cohen's relationship has evolved, where, he talks to me about his baby, and he talks to me about his practice. And, just grow together with the people that you train from, the people that you work with. Find a good mentor, because a good mentor who gives good advice and good direction can really help you with your career.
Excellent advice.
I think Dr. Beer gave amazing advice. I have a great mentor myself that I spend, I walk with once a week at night. I think the only advice I would give right now, this world is full of, amazing people that all have, the best interests at heart. We get there from different, angles. And I just really hope people can have like a lot of understanding and most importantly, just respect for other people, because, this is a very stressful time for everyone and we all want, good to prevail. And I really hope that, everyone can just have a little bit more patience with other people and just really be, even if it's, you don't have to agree with someone's opinion, but I do think you have to respect it. In these challenging times, I think having extra respect and extra understanding is just that much more important.
There's clearly, these guys are really smart guys. They've done it right. I was literally going to share the same sentiments. I think we are in a really interesting time in our history, and whatever our individual opinions are, I think how do we take those opinions and make it so that another person feels that they're validated. But at the end of the day, it's important to know what are things that have been repeated in history over and over, what are things that have been supported by facts versus being respectful of other opinions, but coming to consensus, right? Like, I think that's the challenge. Having disagreements but not moving forward doesn't make sense. You gotta make positive steps in saying that I've listened to different things and I've come together to make a difference in some part of it. So I love these guys. I mean, these guys you're getting the best advice, Sam, from both of them. And it's just telling, like, you look at all the different ways that people have come together, friends that have thought about their career and their life. So I'm with both of them. Opinions and relationships are probably the single most important impact, and be skeptical as well as think through. I mean, take anything that you hear and tease it out for yourself, validate it and don't validate it. But you have to take that step. Don't just kind of be like, okay, I'm going to be the guy that's just taking in stuff without really thinking rationally through it of whether it makes sense.
Yeah. No, I think that's so key what you just said. I think as crazy as this year has been for everyone, I think the awareness that we all need to have and the active thinking with what we hear and what we understand and coming to our conclusions and not just parroting what we've heard is, I think more and more people are realizing how important that is. And if you look at it from medicine to politics, it's kind of showing its face everywhere that people are saying, you know what, wait a minute, I can think through that on my own and I can actually come to my own derived
conclusion. Yeah. It's
important. Yeah.
Excellent. Well, thank you so much, gentlemen. Again, this was a wonderful time. I think at some point in the far future, we're gonna have to, or maybe even near future, we're gonna have to have a part 2 because this was great.
Yeah, definitely.
If your time's up, I'll keep going.
Zach might have another kid by then.
Yeah, I know.
I hope we can do it on the West Coast. Do it over beers, hot dogs, beer,
right?
And
good.
We're gonna have to see Dr. Baber and his good looks.
Yeah,
right. You'll have a camera this time. So this was great. Thanks again, guys. And this is wonderful. So I'll keep it.
Definitely a great way to start the day.
Yeah, definitely. All right, you guys.
Zafeer, Samuel, thanks for having me. Thanks for making this happen, Zafeer.
Thanks so much for the
invite. Thanks, guys.
Very honored to be part of this.
Definitely.
Yeah, it was good. It was a lot of fun.
Wasn't that great to listen to? What I loved about that episode, you can tell that, we had fun. We had fun in that discussion. It's nice to spend time with a group of individuals that know each other and have all shared a very similar life experience. The insight was excellent. Everyone had something to say, but they all had a slightly different take on what's going on. Yet, as far as the solutions were concerned and what to do about it, everyone was in agreement. One thing that we all talked about was, or that we all ended it with anyway, was the relationships and how important relationships are, especially in this time. From isolation to just how do we get around not feeling isolated when everyone has to spend so much time in their own space? And how do we maintain and remember that we got to have a lot of respect for our fellow people? I mean, we got to do what we can to maintain good relationships and create good relationships. And it's incredibly valuable, and it can help all of us, from providers to manufacturers to the sales reps that work within them to the patients. It can help all of us be more sustained through this challenging time. And they really spoke to that, and it was excellent to talk about. A couple other things that I want to make sure we keep in mind from this interview. Everyone's trying to figure it out. I think with the public, it's easy to confuse the public, right? Because you have the news and you have the president, and you have everyone saying different things, and who knows what's what and who knows what's real. But it's good to know that providers understand that, and they're kind of dealing with the same thing. And they're fighting to make sure that the facts remain the facts, and that science remains science, and that what makes sense from their perspective, because they're providing care for us, is consistent and maintained, so that we can all be taken care of with this whole pandemic. And we also touched on what they want to see moving forward when it comes to working with manufacturers. And you notice that every one of them highlighted how important the relationship needs to be with the representative. That's why I say this is so critical for everyone to hear, whether you're trying to get in, whether you're in, or whether you're leading the way. Because you can see that, it's not always about the technology. Of course, providers want amazing technology in their practice, especially if it makes these procedures more effective and these outcomes better. But at the end of the day, you got to have a good relationship with the representative. That can't be, you can't get around that. I mean, even Dr. Baber said, as far as he's concerned, the relationship with the representative is more important than the technology in a lot of cases. And that's great, because it empowers someone that is a sales rep or a sales leader or a sales professional or wants to be one. It empowers them, and it lets them know that, hey, you know what? Your role is a critical role. So you showing up and being the best you can possibly be, or you want to be in this industry and realizing that you need to come in and be the best you can possibly be, is an important thing to take to heart. And it was so nice to hear from the providers that perspective. So again, thank you for listening to the Medical Sales Podcast. If you're someone that wants to get into a role, you've been thinking about this, you've been saying, you know what, I want to be a medical sales professional, then make sure you visit evolveyoursuccess.com and take the assessment. On the homepage, you can select Attain a Medical Sales Role, and you can take the assessment, and it'll guide you through showing you what you need to have and giving you the opportunity to get in conversation with us here at Evolve Your Success and get a hold of some resources that can really get you into the position you want to be in. And if you're a medical sales professional and you want to really improve your performance, you want to have that great relationship with your provider, you want to do things that maybe you haven't been able to do, maybe because of what the environment COVID's put you in, or maybe it's because you know that some skills that you want to better develop to be that much more effective and be that true resource to providers like the ones you heard today, then again, make sure you visit evolveyoursuccess.com and select Improve Sales Performance. And let's have a conversation and talk about how our resources can help you be that much more effective. I always try to bring you the best guests so that you can get true insight on what happens in pharmaceutical sales, medical device sales, what really happens in genetic sales, lab sales, what's really going on, not just from the manufacturer's point of view, but also from the provider's point of view, and also from the representative's point of view, and even the leader's point of view. And I intend to do that every week, so make sure you tune in next week for another episode of the Medical Sales Podcast. I hope you enjoyed today's episode. And remember, I have a couple programs that show you exactly how to break into the medical sales industry. become a top-performing medical sales professional, and also how to masterfully navigate your career to executive-level leadership. Check out these programs and learn more at evolveyoursuccess.com. Stay tuned for more awesome content with amazing interviews.